Welcome back, everyone. This is part 2 of the skeletal system, which obviously is chapter number 8. Just a quick reminder, part 1 covered the axial skeleton. And what we're going to do now is take a look at part 2, which is going to be all about the appendicular skeleton. All right, now before we continue on, please make sure that you have your bone list so that you can go ahead and follow along and have your study guide ready. There will be no images on the exam, but you will have plenty of images on your homework assignments so that you'll be able to practice identifying them based on illustrations. On the exam, we are going to be using our study guide to help us identify the location as well as any type of particular structure that we need to know for the listed bones. All right, so once you have your worksheet for chapter 8, your bone list for chapter 8, which can be found in the exam 2 folder on D2L, go ahead and locate the appendicular skeleton, and what we're going to notice is that the appendicular skeleton is going to be composed of all the highlighted green sections on the image that we're looking at, and that will involve the appendages, the extensions, which will be the arms and the legs, and also we have to take a look at the girdles. The girdles are going to be our connecting points that will allow us to anchor the arms and the legs onto the axial skeleton. We are going to start on top, so the upper body, and then work our way on down. So on the list, we see that the first thing we need to look at is our pectoral girdle. This one is going to allow us to attach our upper limbs, aka our arms. We also see that it allows for muscle attachment, and that obviously will go in hand with extending motility to that region of the body. Now, the pectoral girdle is going to be composed of the clavicle and the scapula. You can see them highlighted right over here, clavicle and the scapula. So let's go ahead and zoom in and see what these bones actually look like. All right, first off is going to be your clavicle. Your clavicle is, I think, more commonly called your collar bone. So we can some of us can actually see our little collarbone. We have a prominent collarbone, meaning that it kind of sticks out, and we see it running along the length of our top of our thoracic region. It is going to be an excellent connecting point to the sternum and the scapula. The scapula is basically your shoulder blade. So here it is. So if you do, just go ahead and take a look at the insert that's on the bottom right. And you can see right here, this is the back you're looking at. So you can see your scapula, little shoulder blade. And then here towards the front, that is your clavicle. So you can see how the collarbone sort of wraps around and connects with the scapula. And then notice how it will provide an attachment point for the head of the humerus, which is the bone that makes up the top part of the arm. In fact, what I wrote down for you in your notes is that under the scapula, we have two notable structures. We have the glenoid cavity, which you can see right here, and you can also see it right here. The glenoid cavity is going to be a little dip, a little housing mechanism, where the head of the humerus will attach. So that's the anchoring point. Then you also have the acromion. The acromion right over here is going to be the attachment point for your collarbone, for your clavicle. So the acromion up front is where the clavicle connects, and then the glenoid cavity, which is more towards the side, is where the head of the humerus, which is the top bone of your arm, is going to be making its connection. And collectively, the clavicle and the scapula will make up your pectoral girdle. All right, so here's a look. Now we're going to go down the top appendage, which is going to be the arm section. So starting on your upper arm, this is going to be the humerus that we're looking at. You can see that for the humerus, we have a little head section, which fits within the glenoid cavity of the scapula. We also have what they like to call a surgical neck, which is the narrowing part as the diaphysis or the shaft starts to form. This actually turns out to be the most frequent fractured part of the bone, so I definitely wanted to kind of highlight. And that partly has to do with its narrowing or tapering out, as well as with the fact that the twisting of the arm can cause the bone to go ahead and be fractured in that particular location. Another item I want to point out is going to be the deltoid tuberosity. A tuberosity is a little protrusion or extension, so you can see how it kind of extends from the shaft region. The deltoid tuberosity will actually be the attachment point of the deltoid muscle. The deltoid muscle is the muscle that makes up your shoulder, so that's how that muscle attaches to the humerus bone. Towards the bottom, you're going to notice that the humerus will also have these little extensions called epicondyles. The ones that are towards the side of the body are called lateral epicondyles. The ones that are pointing inside the body, so towards the belly region, those are called medial epicondyles, because medial means your midpoint. These have nerve openings where the nerves can radiate out for. This is why if you ever hit what they call your funny bone, so you hit kind of like by your elbow and it really hurts, and they'll say, oh, you hit your funny bone because you hit the humerus. Get it? Ha 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 ha. The reason it hurts so much is because of the nerves that runs through that particular section. All right, so the humerus is on top, and then below your elbow, the bottom part of the arm, we're going to have two bones that come into play. They are going to be your ulna and your radius. Your ulna is going to be on the side of your pinky. Here's your little ulna. And you can't really see it from this angle, but the ulna on top has a little dent, the trochlear notch, which forms a U when you look at it. On the other side, we have the radius. The radius is going to be on the side of the thumb of your hands. That one is going to have a perfect little circle on top in this head region. And like I said, you can't really see it from the illustration, so my apologies. And I didn't really list that feature on our list, but I wanted to point it out for those of us who are in lab. That's one of the ways you can distinguish the ulna from the radius, is the fact that they have that U shape on top, where the radius has that perfect circle. And you know, you calculate the radius of a circle to help you remember it. Connecting the ulna and the radius, you have a little interosseous membrane. This is just a little connective tissue membrane that you can see right here, connecting the two bones together. So you're going to have the humerus that sits above it, and then below it are going to be your hands. So let's take a look at what makes up the hands. First thing is going to be the wrist section. So here are the little hands. You can see them right here. The first part is your wrist. Those are called the carpal bones. Now, when you look at your carpal bones, you're going to notice that you have 8 of them, and they've been highlighted either in yellow or green, depending on if you're looking at your distal or your proximal row. So proximal is going to be the one that's closer to the body in yellow, and distal is going to be the one that's further away from the body, highlighted in green. Now go ahead and take a look at your Microsoft Word document, your bone list. And I wrote down for you that the carpals are located in the wrist section, 8 bones, and there's a little mnemonic that will help you remember them in order. It is some lovers try positions that they cannot handle. And what you're going to do is you're going to take the first letter of each word, and it's going to help you remember these in order from proximal to distal, from lateral to medium. So from the side to the medium towards the midline of the body. So in your proximal view, you're going to notice that you have your scapuloid, followed by your lunate. Let me help you along the way. Here's the scapuloid, followed by your lunate. Then you're going to have your triquarium bone. That one's going to be finished by the pisiform, and that will take care of the proximal row. So scapuloid, lunate, triquarium, pisiform. So that's the some lovers try positions. And then the distal row in green is going to start off with the trapezium. That is going to leave us to the trapezoid. And then we're going to go over to the capitate. And then last but not least, we're going to go ahead and take a look at the hamate. Here we go. And this will then take care of that they can't handle. Please, for your exam, know which bones go in the distal section and which one go in the proximal section. And it wouldn't hurt to know the order either. So which ones are going to start on the left, on the lateral side, versus which one are going to be on the medial side. Also, I probably should have mentioned this earlier, so my apologies. If you are having issues with the terminology, such as for the orientation, like what's the frontal, the ventral, the occipital, there's lateral, I want you to go ahead and go back into the McGraw-Hill textbook and take a look at the atlas, the first few pages in the front of the book. They will have an explanation of what these orientation terms are. You can also see them in chapter 1. And if you have the lab manual, you can also find it in the atlas over there. So if you have some issues with the orientation, these are just the common terms that they like to indicate. So instead of saying in the front or in the back, they'll say terms like anterior, posterior, laterals to the side, medials towards the middle. So if you need a little refresher, that's okay. It happens to the best of us. Go ahead and take a look at the atlas, or like I said, chapter 1 in the McGraw-Hill book will help you with that. And obviously, if you have any questions, please do let me know. All right, so the carpals are making up your wrist, and then the palm is going to be called metacarpals. Now, as you can see with the palm, you basically are looking at bones, elongated, beautiful long bones. And also what I want to point out is notice how the fingers are numbered 1 through 5. 1 is what starts off with our thumb, and the thumb is also called the pollex from an anatomy standpoint. And then the other ones, as you go next to the thumb, it's your point finger, your middle finger, your ring finger, your pinky. Those are then going to be 2, 3, 4, and 5. So that's how you're going to distinguish them. Your pollex is going to be composed of 2 phalanges, where the other ones are going to be composed of 3 phalanges. Phalanges are your little bones that make up your fingers. So here you have them, phalanges. And notice how when you come to the side, you have a proximal phalange, that's the one that's closest to the body, a middle phalange, and a distal phalange. But if you look at the pollex, your thumb, you only have a proximal and a distal. You do not have a middle. And that's one of the reasons why when you take your fingers and you curl them, you're going to notice that your 4 fingers, 2, 3, 4, 5, are able to kind of curl into 3s, whereas your thumb only into 2. And that is actually very beneficial because it makes it opposable, which allows us to grasp objects tighter. All right, so when it comes to the hand, you have your carpals that make up the wrist, you have your metacarpals that make up your palm, and then you have your phalanges that make up the fingers. Start numbering at 1, that's the pollex, that's the thumb, and then you just go down the row until you get to 5, which is going to be your pinky. Beautiful. All right. So now let's go ahead and take a look at the lower body, and let's take a look at our pelvic girdle. The pelvic girdle, very similar to the pectoral girdle, is going to be an attachment point for the appendages. This one will now take care of our legs. It's going to allow for the attachment of the lower limbs. Excellent for weight distribution and support, and obviously it will also support all the organs that we find within the abdominal as well as the pelvic region. So right here what we're looking at is going to be called our coccygeal bones, which are more informally called our hip bones. Fun fact, they actually start off as 3 individual bones. The ilium, which comes into contact with the sacrum. Remember, the sacrum is the bottom part of the vertebra that sits in between the hips. And then you have your ischium. That's the second part. And then the bottom part is going to be called the pubis. And these 3 bones are individually in children, and then as we enter adulthood, they will merge together, and part of that so that they can increase the strength that they can provide to the pelvic girdle. I did indicate that on the pubis, the bottom part, there are two structures that we should point out. One of them is the arbiter foramen. That one is going to be this little opening right over here. So you can see it protruding. And then the pubic symphysis is the little joint. It's a little interpubical disc. That's going to be a connection point that will allow you to connect the right and the left hip. You also have the acetabulum, which we can't really see from this angle. It's labeled over here, but I'm going to show it to you from a different angle. This is going to be a large socket. This is where the head of the femur attaches. So when people say that they're getting a hip replacement, what they're often doing is that they are replacing and repairing the hip joint that's formed by the acetabulum and the head of the femur. All right, oh, here's a nice little view. Notice how it's also color-coded, so you can clearly see where the ilium, the ischium, and the pubis originally were formed, and then you can see the acetabulum, the large socket, I should say. This one is a lot deeper and sturdier than we saw in the pectoral girdle, like when we were looking at the little glenoid cavity where the humerus attaches. That one isn't as sturdy as the acetabulum, and part of that is because the femur bone is basically going to be one of the strongest bones in the body, and it's going to allow you to carry a lot of weight. So that's why it has to be a deeper, sturdier joint that we're looking at. All right, so here's just a quick comparison of your male versus female coccygeal bone. As you can imagine, in the female body, we see that it has a wider hip formation, and part of that will have to do with the fact of its child-rearing capabilities. All right, now going down the leg, we see that the upper portion or thigh region is formed by the femur. This is going to be a very long, a very strong bone. This contributes to about 25% of our overall height. As you can see, it has a head section that protrudes outwards. This makes contact with the acetabulum, which we found within the hip bones. And then I also wrote down for you that it has the condyles. The condyles are going to be towards the bottom part. Here you can see them better from the back view, the posterior view. And this is then where they will go ahead and start interacting with the lower leg, which is your tibia and your fibula. And sitting on top of that will be your little kneecap, your little patella. I did write down for you on your document that it's a sesamoid bone. And a sesamoid bone, as you might recall from our previous discussion in Chapter 7, is a bone that forms as a result of stress being placed in that area. So that's your little patella. All right, now the lower leg is going to be composed of the tibia, which some people will call your shin bone. And this one is a very strong weight-bearing bone. And a fun fact, when we look at muscles, we're going to talk about the fact that not the entire tibia bone is covered with muscle. So it doesn't have that extra protection of the muscle layer. In addition, there's also lots of nerves that run through it. This is why if someone kicks you in your shin bone, if they kick you in a location that isn't protected by muscle, it can be extremely painful because of that connection it's going to make with the nerves sitting directly on the bone. So the tibia is towards the front, excellent weight carrying capacity. Unlike the bone that sits behind it, the fibula is also long, but it's very thin, and you can kind of see this comparison in the posterior view. The fibula has absolutely no weight-bearing capacity. It is covered by the gastrocnemius, which is your calf muscle. In fact, there have been cases where if a patient comes in and they need to have like a bone donor, if there's some damage to bones to one area and they want to repair it, they will actually go in and take a piece of your fibula, and it will absolutely not affect your body's weight-carrying capacity or your ability to walk around and maneuver around. So little fun fact. So I did write down for you on your list, no weight bearing. It doesn't articulate with the femur. But like I said, it is covered by the gastrocnemius, which is your calf muscle. We're going to talk more about that in our chapter 10. And then there is an interosseous membrane, just like we saw with the ulna and the radius, that will go ahead and it will connect your fibula and your tibia. Beautiful. So we have the femur on top, and then you have your tibia and your fibula at the bottom. So that's going to be your leg. So quick recap. For the arms, we have the humerus, ulna, and radius. And then for the legs, we have our femur, tibia, and fibula. Okay? And then now what we're going to do is we're going to take a look at our foot. So remember how we had our carpals when we were looking at our hand? Well, when you look at your foot, you're going to have your tarsals. Haha. Same concepts. We're going to start off with the tarsal. This is going to make up your ankle region, the top part of the foot, or the connection point of the foot to the tibia. And what we see happening here is we have another mnemonic, because it's 7 bones that we want to know which one makes up the distal and which one makes up the proximal row. So please follow along with the color coding. We're going to start off, and the mnemonic is tiger cub needs milk, M-I-L-C. T is going to be for the talus, excellent weight-bearing bone. Your C is going to be for your calcaneus. This one actually is what makes up your heel. Obviously also weight-bearing. Then we're going to have our cuboid. That's going to be the one that's going to be in the distal group, followed by the navicular. I'm trying to highlight it so you can still see the name. And then we're going to have the cuneiforms. And the cuneiforms, we're going to start looking at the one that's pointed closer to the midline of the body. So we're going to have the medial cuneiform, followed by the lateral, the intermediate cuneiform, and then your lateral cuneiform. So talus, calcaneus, cuboid, navicular, medial, intermediate, and lateral cuneiforms. Okay, tiger cub needs M-I-L-C, milk. So that's just a little quick way that you can remember them in order. Very similar to when we discussed our carpals. Please make sure that you know which one are part of the proximal and which one are part of the distal group. The top part of the foot is going to be called metatarsals. Remember, just like you had metacarpals for the palm. So you're going to have metatarsals. Same concept that we used. We're going to keep that going when we take a look at our feet versus our hands. And then once again, notice how they started by the big toe when it comes to numbering. That's number 1. Now, the big toe is actually also called the hallux. Just like the thumb was the pollex, so the big toe is the hallux, and then you're going to count down 2, 3, 4, 5 as you make your way over to the pinky, or the little toe, and then your actual toes, just like your actual fingers, are going to get the same names, phalanges. And the phalanges, once again, are divided into 3 sections, distal, middle, and proximal. And notice how those 3 will only apply to numbers 2 through 5. And that's because your big toe, number 1, the hallux, only has a distal and a proximal phalanx. Okay, so it only has 2, where the rest of them have 3. And the nice thing with that is that brings an end to the appendicular skeletal system. See, this one isn't as bad. Not as many bones as when we take a look at the axial skeletal system. All right, so I'm going to go ahead and stop over here. Please take your time, work your way through it, have your list with you. That's what you're going to be studying off as you get ready for your exam. And as always, if you have any questions, comments, or concerns, please do not hesitate to contact me. All right, we shall talk soon.